All right, good morning and welcome back. 9:42, time for our Plastic Surgery Today segment with our sponsor, Bay Area plastic surgeon, Dr. Stanley Jacobs. Hello, Doc.
Good morning.
Today we're talking about anesthesia.
Yes.
And the risks. And I was just saying, you know, if I ever have to go in for something, I will be fine. I don't,
right.
you know, I just assume,
right?
right?
We go through
it's
life
no
that
big
way.
deal.
Most people go through life, you know, you're gonna ski, you're not gonna really fall. If you drive, you're not gonna have an accident.
Right.
We go through life the opposite, like the worst case scenario handbooks are like our lives, you know?
Yeah.
So if something bad's gonna happen.
You really worry about that. I mean,
every day, every minute.
I would think you're just worried about making my face right,
No.
right? And which is what I'm worried about. I'm not worried about the anesthesia.
No, I'm worried about anesthetics and medical risk, which we talked about last week. But the anesthetic risk, we're gonna talk about today. I actually started off by giving some websites and things that people can look for or look at. There's an American Society of Anesthesiologists, the ASA, they're called, and that's their website. The American Association of Nurse Anesthetists, who do extra training to be anesthetic people, and actually 65% I found out of all anesthetics that are done in the country are done by nurse anesthetists. So there's that website, and I use both those types of people, mainly nurse anesthetists. And then there's e-medicine and Medline searches, so you can find out.
Well, find out what? Why do I want to go? What do I need to know about anesthesia? I mean, really.
People want to know about things. Plus, they're actually pretty good websites. They tell you about anesthetic risk. They tell you about things that are being researched, papers. So people want to know more about what's going on. In fact, the next slide talks about some of the risks that are common.
Well, here, I have a question, though.
Yeah.
If there's such a risk, and it's elective surgery, do I really need my nose fixed? You know what I mean? Like, how do you weigh?
Because if you look at this, there's one death out of every 250,000 people of all anesthetic deaths.
Okay.
That's all people of all kinds, whether you're sick, dying, not dying.
Well, that seems very low.
It is very low.
Okay.
That's why I'm saying that. And that's why the ASA classifies people in 1 to 6. So 1 is like super healthy. 6 is actually organ donor.
Okay.
Brain dead.
Okay.
So obviously, people that we operate on are P1s, maybe P2, which is a sort of a little illness that they may have.
Okay.
That's it, that they live with.
Wait, so you're saying you'll look at me and decide if I'm too risky?
Exactly.
Like that the anesthesia alone would be bad.
That's right. And anesthesia is generally very safe. Anesthetics are actually good for your heart. They relax it. And, you know, we're all stressed and anxious, but it actually relaxes it. Now, obviously, there's risk, but if somebody comes to the table, as they say, with a medical problem, they need that medical clearance before they show up.
But here's the thing. So with your business, I'm gonna say, well, I'd like to be knocked out because I'd feel less. Or I'll say, hey, let's eliminate the risk. Can't you just do all this stuff with some kind of local?
Well, there's different kinds of anesthetics. There's local, regional, sedation, and general.
Okay.
Okay, local just means straight numbing stuff, which stings like heck.
Right.
If you could put up with that and lie still.
Yeah.
You know, but that's,
Okay.
And then there's regional means like if you have an arm done and they put a nerve block up here and your arm's numb.
Okay.
That's a regional. And then there's sedation anesthesia, which is really what I do most of, which is the anesthetist or anesthesiologist gives an IV sedation. You're sleepy, but you still breathe on your own. Right. Like you're sleeping in bed.
Right.
And then I put the local, so you don't feel anything.
Right. So that's and it's less risky than.
And it's less. Then it's not a general.
Full anesthesia.
A general anesthetic means your body's paralyzed with an agent, so you don't breathe. The tube is then put in your throat, and the machine that bellows, respirator breathes for you.
Can't you just pretty much do everything, all this elective stuff with the, short of that?
The sedation?
With the sedation.
Well, it depends. Sometimes they can't get the kind of anesthetics if they're doing like a lot of body work. That's generally going to be more, especially a lot more local, a lot more stuff going on.
Right.
And so it's a little different. So sometimes they do have to do general.
So we should weigh this when we're thinking about maybe I'd like to do this, that, the other thing.
Right.
Do I have to be put out and really consider that?
Consider that and ask the surgeon about that because it's a team. The anesthetist, anesthesiologist, surgeon, and scrub nurse are teams. If they've worked together for years, it's great because they know how each other works. Yeah. Because people just think it's like anesthetic and surgery. It's not. It's together. It's a team effort.
Well, this was that whole recent thing, with Kanye West's mother. That was the whole thing. It wasn't. It was the anesthesia.
It was a medical risk. She had a medical problem that should have been cleared.
Right.
So that's why you have to look at that.
Okay. All right. Great. Well, I guess it's not as easy as it looks.
No. That's why we go to school for so long.
Thank you, Doc. All right. And if you want more information, you can always go to Dr. Stanley Jacobs' website, drstanleyjacobs.com, or you can call him 433-0303.